Hello and welcome to another episode in our series, What is IV Therapy, where we're talking about everything IV. I'm trying to answer questions, I'm trying to dispel myths, and I'm also essentially trying to make you comfortable and feel more relaxed and get informed about the decision of getting an IV therapy. So we have been doing this series now. This is probably our seventh I think, episode in the series. And what I'm going to talk about today, starting with the series, I'm going to talk about the different IVs because I get questions about that. Please feel free to leave comments and also ask me direct questions. And then I'll come here and just try to answer your questions. So one of the popular IVs that we get is a recovery IV. Now, one thing I want to tell you is that different spas, different pharmacies, compounding pharmacies, different doctors' offices, different businesses actually have different names for different vitamins. So one size doesn't fit all, or one size doesn't cover all. However, there are the usual, I like to call them the usual suspects in certain IVs. So if we're talking athlete recovery, there are certain things I kind of expect to be in there. However, different spas, different doctors, different pharmacists or pharmacies add on some, or they take away some. So just because you have, if I'm reading what the ingredients in some of these treatments are, these IV treatments, and you're like, oh, well, my doctor doesn't have that, it doesn't mean it's wrong. It just means they sometimes, there's some add-ons and then they're not. It just doesn't mean that it's not efficient. Or again, you need to understand, sometimes IVs have to be specifically made for you, for your wants, for what your needs are, for what your goals are. But there is a general, like a buffet table. Thank you. I was looking for a word. So sometimes it's a buffet table, and then you pick what you need, or what that company or that pharmacy is compounded with, or compounding their IV vials or treatments with. So the first one I'm going to talk about in this video, without dragging it, is the athlete recovery. The name practically speaks for itself. This is very popular amongst athletes, people who work out a lot. I know gym rats, people who are in the gym 5 to 7 days a week. I doff my heart out to you, because I am certainly not that person. But this is something they need, this is something they do, and it's just part of their lifestyle. So the athlete recovery IV therapy, it's great for them. They love it, they want it, they desire it. And I'm just going to quickly read through you some of the things, some of the treatments you're going to see there, some of the common, not treatment, sorry, ingredients you're going to see there. First and foremost, what is an IV made of? An IV comes in usually in a bag. It comes in a bag it comes in a bag of liquid. And in that liquid, that's where you add the different ingredients. So the major liquid you're always going to find is called lactated ringers or normal saline, which is an isotonic. Without doing so much medical speak, isotonic essentially means is the same kind of fluid you have in your body. I teach IV therapy class. I'm also a nurse instructor. So this is something I love talking about, because you have isotonic, you have hypertonic, and you have hypotonic. Hyper is something of a higher solution than what you have in your body, than the fluid in your body. And then there's hypotonic, which is a lower concentration of the fluid you have in your body. So a lot of times in the IV hydration clinics or treatments, you're getting isotonic. Like when you go to the ER, a lot of times when they're sticking fluid in you because you're depleted, they want to get your medications to you, and also to up your hydration status is an isotonic type fluid, because essentially we're not trying to create any kind of imbalance in your electrolyte or in the fluid inside of you. So that's why the isotonic is the way to go. So, however, there are different treatments, like I've mentioned to you before. There are times when you need hypertonic solutions, and there are times when you need hypo, but we're not going to go into that today. So, so that's what's going to be in your liquid in the bag, okay? And then the ingredients that you would see, you have arginine, you have tri-amino acid or bi-amino acid, which are kind of the amino acids. They're like derivatives of proteins. And what amino acid essentially do is they help with muscle conditioning and recovery. They boost endurance and build muscle mass more efficiently. And you have the ubiquitous B12, which again helps with metabolism. It helps with fatigue. It helps to reduce fatigue and improve muscular endurance. And vitamin B12 is also very, very crucial to the production of nerve cells. So you have the RNA and the DNA and red blood cells, energy levels, they all come into play. B12 is a cofactor of a conversion of the homocysteine and methionine, which is important for DNA methylation. So having said that, again, I'm trying not to go into so much science speak. So but anyway, vitamin B12 will be in there, or vitamin B12. So some common add-ons will be magnesium. Okay, that, if you don't know this, magnesium actually helps in relaxing muscles and it reduces headaches. We have vitamin B12. Sorry, we talked about vitamin B12. Vitamin B complex, where you've got the B1, the B2, the B3, the B5, B6. That's part of your B-plex family. You've got trilament, which is essentially zinc, manganese, and or selenium, or manganese, but I think it's manganese. That's what I call it. You've got glutathione. Again, glutathione, I know I promised you guys, and I think someone had asked me, because a lot of my clients, usually female, okay, ask me about glutathione. I'm going to do a video about glutathione, because it's something, it's like the mother of all antioxidants, and there's so many side benefits that comes from that one singular ingredient. Okay, and then other add-ons that can be part of the athlete recovery IV treatment, it's what is called NAD, you know, Semorain, Canatine. Again, all this, whatever it is you're getting, you need to understand a doctor has to prescribe it. A doctor has to see your health status, your health history, and then determine moving forward what your regimen will be. Okay, so this is what we do when you come to us. We screen you, we hear what you want, what your goals are, what your health status is, because that's a big factor. Everybody doesn't get everything. So that's one of the popular IV treatments. The athlete recovery is very popular amongst our gym rats. People call them gym rats, but people who like to work out intensely. So you need to replete, you need to rebuild, you need to condition and manage and treat your muscles, okay, because they suffer muscle spasms and they just need things that would help them optimize their performance. So you find a lot of basketballers, footballers, wrestlers. I actually have one wrestler. He wrestles part-time, and he comes to get the athlete's recovery. So it's really it's a wonderful and very, very popular IV treatment. If you have more questions and you want more me to talk about the athlete recovery, I will. So in my next video, I will also be talking about other IV therapies that are really popular. And then, you know, if you want to know more, just feel free to comment or reach me directly, DM me. So until I come your way again, be safe, be kind. I'll catch you in my next video.